students, today we will discuss about the monkeypox, and we know as the monkeypox is spreading and it's become a public health problem and emergency nowadays, and it has spread from Africa. Now it has come to the Asia. So we'll discuss what is public health concern, why it is so much concern of monkeypox. So let's discuss. So as we know, the WHO has declared monkeypox as the public health emergency of international concern. And we know that clade 1 monkeypox is spreading nowadays, and it causes more severe disease, especially in children. And clade 1 can be transmitted to the household contacts and often spreads to the children. Previously, in 2022, clade 2 was used to spread through sexual contact. So monkeypox is a public health emergency, and the clade 1 is which is being spreading nowadays. Previously, it was clade 2, and it was spreading through sexual contact. So now let's see how does monkeypox transmit. So there appears the rash, and it is the rash which, if it is not healed completely, it is infectious through skin to skin contact. So there appears a rash on the patients of monkeypox, and this rash, until and it is healed completely, it is infectious through skin to skin contact, and it can transmit the monkeypox. Also, if we touch the surfaces that are already being infected with the person who is having the monkeypox, if we used his clothes or bed linings or towels, the infection can transmit. Also, respiratory droplets and aerosols which are being generated from the patient of monkeypox can spread the monkeypox. And also the prolonged face-to-face contact can spread the monkeypox. Sexual contact, as we discussed, and vertical transfer from pregnant woman to the fetus can transmit the monkeypox. So we'll see now the symptoms. It has a long incubation period which can range from 4 days to 21 days after exposure. After that, the symptoms starts appearing. So it has a long incubation period. Typically, no symptoms appear till 5 to 13 days. The symptoms for the first 1 to 5 days include the flu-like symptoms, which include the fever, headaches, body aches, fatigue, backache, and swollen lymph nodes, which is then followed by the appearance of a rash which contains the fluid, that is vesicular blistering rash, that later on forms the scab. These infections of monkeypox usually last from 2 to 4 weeks. Now we'll see the characteristic of the rash. This rash starts like a pimple. It starts like a pimple or a firm bump that then later on becomes filled with fluid, becomes fluid-filled blister. Then when this fluid gets infected, it forms a pus-filled blister, and then it forms ulceration and then forms the scab. Pustules or scabs must be completely healed before they are no longer contagious. So pustules and scabs are infectious until and unless they are completely healed. These lesions of monkeypox typically appear on the palms of the hands and the soles of the feet. So here we can see first there appears the pimples, then these pimples become filled with fluid and pus becomes the pustule, which later on forms the ulcer and scab. Here we can see the pustules which later on become infected and form then ulcerations, and in the last it becomes the necrotic scab. So the treatment, the illness is usually mild, and most people recover within 2 to 4 weeks without treatment, as with any viral infection. So it is a viral infection, usually recover without treatment, only bed rest and fever reducing medicine we can give. We have to isolate such patients as it is contagious. We have to wear proper mask and provide ventilation, and often wash hand most frequently when we touch such patients. Wearing gloves and mask while using the washing linings or clothes of such patients is important. If we shake the linens of the patient of monkeypox, it can release monkeypox into the air, and that can transmit the disease. About the vaccination, the smallpox vaccine is 85% effective in preventing the monkeypox if we give this vaccine within 3 days of exposure. Also, previously, smallpox vaccine provides some protection against the severe disease, but it does not provide lifelong protection from getting infected or infecting someone else with monkeypox. So that's about the monkeypox.